If you have rheumatoid arthritis, is avoiding medication safe? Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Today, we're addressing a question many people with rheumatoid arthritis, or RA, have asked me. Is it safe to avoid medication if you have rheumatoid arthritis? It's an important question, especially if you're interested in a holistic approach or have only mild symptoms. I'll walk you through when it might be safe to consider non-medication options, what those approaches look like, and when medication is truly essential for long-term joint health. Whether you're newly diagnosed or have been living with RA for a while, understanding your treatment options is key to managing this condition safely and effectively. Rheumatoid arthritis is an autoimmune condition, meaning the immune system, which is normally meant to protect you from bacteria and viruses, is now mistakenly attacking your healthy joints, causing inflammation, swelling, and pain. Over time, this can lead to joint damage, reducing mobility, and even other systemic issues if not properly managed. But here's where it gets interesting. The progression of RA is not the same for everyone. For those with well-controlled inflammation, non-medication options might be a safe way to start managing the disease, so long as regular monitoring is in place. Our goal in managing rheumatoid arthritis is to prevent damage, maintain mobility, and preserve quality of life. And for that, it's essential to determine the right approach for each individual. Some key caveats. Uncontrolled inflammation in rheumatoid arthritis will lead to joint damage and progressive pains and disability. There are decades of experience with medications that control RA, and once there is chronic damage in RA, you cannot reverse that damage. Non-medication approaches like lifestyle adjustments, dietary adjustments, supplements, and physical therapy may work for certain very mild cases of RA. Here's what we look for in patients who might safely avoid medication, at least initially. You should have mild symptoms like occasional stiffness or soreness, which don't interfere much with daily life. Limited inflammation affecting only a few joints rather than widespread swelling and pain. Stable lab results showing low inflammation markers like a normal sedimentation rate or CRP level. No evidence of inflammation on examination, and no evidence of active inflammation on imaging. For example, ultrasound, there are findings that can actually predict progressive disease within the next year if not treated. If these conditions apply to you, it could mean that trying non-medication options first may be possible. However, one thing to keep in mind is that RA can be very aggressive. That's why it's essential to work closely with your rheumatologist to monitor changes over time. Even if symptoms seem mild, there's always a possibility of the disease progressing. In my practice, I emphasize a personalized approach using advanced technology to monitor disease activity closely. If you're going to try non-medication options, it's crucial to make sure these options are working to maintain your health, not just short-term pain relief. To ensure safe, effective management of RA without medication, we need clear tools to measure disease severity and progression. At Chicago Arthritis, we rely on objective assessments, including ultrasound and lab work, to get a detailed understanding of inflammation and joint health. Here's how these tools work. Ultrasound imaging is really important in my view. With ultrasound, we can see inside the joints to detect even small amounts of inflammation or joint fluid buildup, sometimes even before symptoms appear. This non-invasive tool helps give us an objective look at what's happening under the surface. It's also a powerful way to monitor for any subtle changes over time. Lab tests give us another layer of information. We typically monitor inflammation markers like the sedimentation rate and C-reactive protein. Elevated levels can indicate inflammation even if you aren't feeling significant pain. In terms of antibodies, we check them at baseline. If positive, we do not repeat them over time. It does not necessarily correlate with disease activity. If negative antibody testing, we will repeat at some point in the future to reassess your condition. These objective measures allow us to understand if mild RA is truly staying mild or if it's progressing into something that could cause joint damage. For those who are avoiding medication, this type of monitoring becomes even more essential because it allows us to catch any signs of worsening disease before there's permanent damage. While some patients with mild RA might be able to manage without medication, it's important to understand the potential risks. RA can progress even if you're not feeling pain daily if there's underlying inflammation, which is why regular check-ins with your rheumatologist are so important to look for those early signs of inflammation. Here are some of the risks of going without medication. Research has shown that untreated RA, that is causing inflammation, can lead to joint damage within months. Even if your symptoms feel manageable, underlying inflammation can cause progressive damage that might not be reversible. That's why we need to ensure that inflammation stays low. RA can sometimes have silent phases where you don't feel significant symptoms but inflammation is present. If we miss this window, the condition could worsen significantly without early treatment. Also, RA does not just affect the joints. Long-term uncontrolled inflammation can impact other parts of the body, like the heart, lungs, and blood vessels. Medication can play a key role in reducing these risks for those with higher disease activity. By working with your rheumatologist and using tools like ultrasound and lab tests, you can safely explore non-medication options, but with a plan in place to prevent these potential issues. For most patients, if there's any sign of worsening disease, medication may be necessary to prevent long-term damage. While avoiding medication may be an option for some, others with moderate to severe RA will need medication to manage their condition effectively. Medication is generally recommended in cases where there are multiple swollen and tender joints, lab markers indicate a high level of inflammation, examination shows multiple inflamed joints, and if imaging shows active inflammation or joint erosions on ultrasound or MRI scans. Medications like disease-modifying rheumatic drugs or biologic medications can slow down or stop the immune system from attacking the joints, which prevents damage. While medications may not be everyone's first choice, they can make a significant difference in preserving joint health and quality of life. In moderate to severe cases, medications are essential for protecting joints and preventing disability. With close monitoring, many patients find that they can live full, active lives with the right medication plan in place. For those who are exploring non-medication approaches, there are several lifestyle and natural options that can help manage RA symptoms and potentially keep inflammation under control. Here's a breakdown of some of those effective methods. Anti-inflammatory diets, rich in fruits, vegetables, whole grains, and omega-3 fatty acids, can help reduce inflammation. Omega-3s from sources like fish oil or flaxseed oil are especially helpful for many patients. Low-impact exercises like swimming, walking, or yoga can strengthen muscles around the joints and improve mobility. Physical and occupational therapy are also excellent ways to work on joint flexibility and strength in a safe way. Turmeric, ginger, and omega-3 supplements are popular for their anti-inflammatory properties. These supplements are not a replacement for medication in more serious cases. They, however, may provide additional support for mild inflammation. Also, RA symptoms can flare up with stress. Mindfulness practices like meditation, deep breathing, and yoga can help to lower stress levels and support overall health. For many, these approaches can provide relief, but they're most effective when combined with regular monitoring and assessment by your rheumatologist. Even if you're doing well with lifestyle changes, make sure to see your doctor every few months to keep tabs on your condition. Rheumatoid arthritis affects everyone differently, so treatment should be tailored to each person. Some people may do well with non-medication approaches, while others need medication to prevent long-term complications. At Chicago Arthritis, we believe in a balanced approach that combines the best of both worlds. Safe, effective monitoring and tailored treatment options based on each individual's needs. Whether you're considering medication or a non-medication plan, having an ongoing partnership with your rheumatologist will help keep you on the right path. Thank you for watching. Give us a like and subscribe to the channel. If you have any questions or would like to set up an evaluation, feel free to reach out. Again, I'm Dr. Siddharth Damber, and I'm here to help you live well with rheumatoid arthritis.